Hi, I'm Latifah Wan Teh, Bachelor of Medical Imaging, part-time, cohort 1. So I'm going to present the comparison of the radionuclide imaging with other modalities such as MRI and the CT scan. My presentation will cover the comparison of radionuclide imaging with other modalities, image formation and image storage, and also advantages and disadvantages of radionuclide imaging. This is the comparison of radionuclide imaging with other modalities. As we know, radionuclide imaging is an imaging technique that uses a small dose of radioactive material, or we call radioisotope, and also we call a tracer for diagnosis, therapy, and medical research. Radionuclide imaging is the most often performed procedure in molecular imaging. So that's why we call it nuclear medicine. So nuclear medicine has been performing molecular imaging since the first radionuclide studies that were performed with sodium iodide for diagnosing and treating the thyroid cancer. In contrast to radiology procedures, which determine the presence of disease based on structural appearance, nuclear medicine studies determine the cause of a medical problem based on organ or tissue function or physiology. Nuclear medicine or radionuclide imaging enables to produce a quick and accurate diagnosis for a wide range of conditions and diseases at any age. So therefore, this allows the appropriate treatment to begin as early as possible, which gives a far greater chance of being fully effective. The test also painless, and most can expose patients to only a minimum amount of radiation. The comparison of radionuclide imaging with other modalities. For radionuclide imaging, for PET and SPECT-CT, we'll compare with the traditional MRI and CT scan. So the modality information, so the measures for PET-CT and SPECT-CT, it shows the physiological function of the tissue or organ being investigated. However, for the MRI and CT scan, it only shows the anatomy or the structure. The resolution, PET and SPECT-CT is about 3 to 5 mm, and for SPECT is 8 to 10 mm. However, the MRI and CT scan provide the best resolution, which are from 0.5 to 1 mm, and for the CT 1 mm to 1.5 mm. The technique for PET is using the positron, the concept positron annihilation, and for the SPECT is gamma emission. The MRI is use the technique nuclear magnetic resonance (NMR), and for the CT is absorption of X-ray. The harmful effect for PET and SPECT-CT, of course, the radiation exposure. For the MRI, so far, none known. And for the CT, also give the radiation exposure effect. The number of examination per day for PET-CT can be 4 to 12 cases. For SPECT-CT, 5 to 10 cases. MRI 10 to 15 cases, and CT 15 to 20 cases. This is the image formation and image storage diagram. Scanners has evolved into the complex imaging system known today as gamma cameras. These cameras are still scintillation detectors that use a thallium-activated sodium iodide crystal to detect and transform radioactive emission into light photons. Through a complex process, these light photons are amplified and their location are electronically recorded to produce an image that is displayed as a hard copy or on computer output systems. Scintillation cameras with single or multiple crystals are used today. The gamma camera has many components that work together to produce an image. As you can see in the slide, this is the cross-section of body showing radioactive tracer in organs. This is the part of the component for a gamma camera. This is a collimator, and sodium iodide thallium activated crystal, a photomultiplier tubes, either single or multiple, and this is a pulse height analysis amplifier, and the information has been converted to digital computer systems, and the images can be displayed in packs or can be printed in hard copy. The collimator located at the face of the detector. So where the photons from radioactive sources first enter the camera. The collimator is used to separate gamma rays and keep scattered rays from entering the scintillation crystal. Resolution and sensitivity are terms used to describe the physical characteristic of collimators. Collimator sensitivity is determined by the fraction of photons that are transmitted through the collimator and strike the face of the camera crystal. Spatial resolution is the capability of a system to produce an image in which the small details are observable. Collimators are usually made of a material with high atomic number, such as lead, which absorbs scattered gamma rays. So different collimators are used for different type of examinations, depending on photon energy and the desired level of the sensitivity and resolution. This is a crystal light pipe. So the scintillation crystal commonly used in gamma camera are made from sodium iodide with trace quantities of thallium added to increase light production. So this crystal composition is effective for stopping most common gamma rays emitted from the radiopharmaceuticals used in nuclear medicine. So the thickness of crystals varies from uh, 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 1/4 inches to ½ inches, and the thicker crystals are better for imaging radiopharmaceuticals with higher energies above 180 keV, but has decreased the resolution. So the thinner crystals provide improved resolution, but cannot efficiently image photons with a higher kilo electron voltage. So a light pipe may be used to attach the crystal to the PMTs. So the light pipe is a disc of optically transparent, a transparent material that helps direct photons from the crystal into the PMTs. So this is a detector electronics. As an PMTs is attached to the back of the crystal light pipe. So inside the detector are PMTs used to detect and convert the light photons emitted from the crystal into the electronic signal. Yeah. Then from the crystal into electronic signal that amplifies the original photon signal by a factor up to 107. So a typical gamma camera detector head contains 80 to 100 PMTs. Multi-head gamma camera system. So the standard gamma camera is a single that can be moved in various positions around the patient. So the gamma camera system may include 3 detectors. A dual head gamma camera system are the most common be used because it allows for some simultaneous anterior and posterior planar imaging, and are ideal for the SPECT CT. So the triple head system are not as popular as dual head system and are generally used for brain and heart studies. Although the triple head system are primarily suited for SPECT, they can also provide multiplanar images. So and then last one is computers. So computers has become an integral part for the nuclear medicine imaging system. So computers are used to acquire and process the data from the gamma cameras. So they allow data to be collected over the specific time frame or to the specific number of counts, and the data can be analyzed to determine the functional changes occurring over the time. Okay. The computer also allows the operator to enhance a particular structure by adjusting the contrast and brightness of an image. So the image also can be seen in the PAC system. The advantages of radionuclide imaging in nuclear medicine. So nuclear medicine exams provide unique information that often unattainable using other imaging procedures. So this information may include details on the function and anatomy of the body structures. So nuclear medicine provides the most useful diagnostic or treatment information for many diseases. A nuclear medicine scan is less expensive and may yield more precise information than exploratory surgery. Nuclear medicine offers the potential to identify disease in its earliest stage, often before other diagnostic tests can be detect symptoms or abnormalities. By detecting whether lesions are likely benign or malignant, for example, PET scan may eliminate the need for surgical biopsy or identify the best biopsy locations. PET scan also may provide information for radiation therapy planning. The radionuclide therapies target cancer cells while limiting the radiation exposure to healthy tissue. So they are typically well tolerated. Treatment periods may be shorter than other cancer treatments with fewer side effects. The disadvantages of the radionuclide imaging on nuclear medicine. So radiation exposure depends on the radionuclide and dose used. Effective doses tend to range from 1.5 to 70 millisievert as in the following. For example, for lung scan about 1.5 millisievert, for bone and hepatobiliary scans about 3.5 to 4.5 millisievert, for technetium system B heart scans about 17 millisievert, and the reactions to radionuclides are very rare. The area that can be imaged accurately is limited because only signals near the gamma camera face can be accurately localized. Image detail may also be limited. Often, imaging must be delayed for up to several hours to give the radionuclides time to reach the target tissue. The resolution of images may not be as high as that of CT scan or MRI. That's all my presentation, and thank you.